Welcome back to Great Day. February is American Heart Month, so several times over the next few weeks, we are going to share stories and interviews that all involve your heart. And this morning, we are happy to have Dr. LaRue with us. He's a cardiologist at St. Luke's Hospital in Chesterfield. Good morning to you, sir.
Good morning to you, and thank you so much for having me.
We are happy to have you today. And your focus is heart failure, which as a normal person sounds very, very alarming to me. What exactly is heart failure?
Yeah, so and it can be scary, but maybe less so when you learn a little bit about it. So heart failure really is just a condition where the heart is not able to pump blood as well as it needs to meet the needs of the body. It doesn't actually mean one specific disease, but it's a whole collection of diseases that all cause kind of the same symptoms. So we like to divide it really in two ways. We think about heart failure that comes from the heart muscle being weak or damaged. So a way to think of it, the heart's a muscle just like other muscles in the body. So if your bicep is weak or damaged, it can't squeeze like it's supposed to or lift as much weight. Well, the weight for the heart is pushing blood forward. So if the heart muscle is weak or damaged, it doesn't push blood forward like it's supposed to, and that can cause symptoms. About the other half of people get heart failure even though their heart squeezes normally, but it's stiff. So when the heart's stiff, it takes higher pressures to fill the heart so it can pump. And those high pressures can filter back to the lungs and the veins and cause the symptoms of heart failure.
Let's talk about those symptoms. What are they and what are some of the risk factors?
Yeah, great question. So the symptoms that we see most commonly in heart failure is people just get out of breath, especially with activity or exercise. Sometimes they'll even get out of breath with routine things like walking across the room that wouldn't have caused trouble before. Another really common symptom is swelling. So people with heart failure will get swelling in their legs, their feet, even their abdomen sometimes. Beyond that, the couple other things we can see is a lot of fatigue, and then some people will actually get out of breath if they lay down flat, or they'll wake up from sleep out of breath and have to sit up at the side of the bed. So all those things will make us think of heart failure. Risk factors, so there's also a lot of things that we know put people at risk of developing heart failure. One of the most common things is actually high blood pressure. We know high blood pressure is probably the biggest risk factor for heart failure. Along with that are blocked arteries or coronary artery disease, another major risk factor for heart failure. And then tied very closely, unfortunately, with coronary disease is just tobacco use or cigarette smoking is a big risk factor. Some things that we see a little less often but still risk factors are being obese, diabetes, problems with the heart valves can all cause heart failure. And then finally, there are viruses that can also make the heart muscle weak.
Once you do diagnose someone with heart failure, how do you treat it?
Right, so another great question. So there's a lot of treatments available for heart failure. First and foremost, there are several medications that can help treat the symptoms. So they make people breathe better, be able to be more active, stay out of the hospital, less swelling, all those things. For those that have heart failure with a weak heart muscle, there are actually some medicines that can help the heart get stronger and help people live longer. There's some non-medication type things, such as improving the diet with less sodium and salt in the diet. We have cardiac rehabilitation programs to help people be active. And then depending on the causes, sometimes if people have blocked arteries, they can have bypass surgery or stenting to treat that. You know, valves can have surgery to treat the valves. And then sometimes people with heart failure also can benefit from pacemakers and defibrillators.
You're so calm in your delivery about it, and basically you're saying there is hope for a lot of people who are diagnosed with this, and that's what we like to hear.
Absolutely.
Dr. LaRue, good to see you. And if you would like to get in contact with him or any of the amazing cardiologists at St. Luke's Heart and Vascular Institute, visit their website, stlukes-stl.com/hearthealth, or call the number on your screen. It is 314-205-6801.